Chagas disease is caused by the parasite Trypanosoma cruzi. It has been most commonly spread by infected bugs called triatomines, but it can also be spread through blood transfusion, organ transplantation, congenitally, and through lab accidents. In Latin American countries, the triatomines are known by other names such as kissing bug, binchuca, vinchuca, or barbero. The disease is endemic in many areas of Mexico and Central and South America. People living in the U.S. who have migrated from these areas may be infected. It's estimated that there are 300,000 or more infected Latin Americans in the U.S., most of whom are not aware that they're infected. Although there are triatomines in the U.S., vector-borne cases of Chagas disease have rarely been documented. In Latin America, triatomines thrive in poorly constructed and usually rural housing conditions, where they live within mud walls and thatched roofs. At night, they emerge from their hiding places to feed and then defecate on people. Transmission occurs when parasites in the bug feces enter a wound or penetrate a mucous membrane, such as the eye. Acute infection, which is often asymptomatic or characterized by mild illness, lasts an average of 4 to 8 weeks. The infection then becomes chronic, and people typically remain asymptomatic for years or even decades. Approximately 20 to 40% of chronically infected people eventually develop clinical disease, typically with cardiac and occasionally with gastrointestinal manifestations. Chagas can be life-threatening in both the early and late stages of the infection. In chronic infections, cardiac disease usually begins with conduction abnormalities, such as right bundle branch block and/or left anterior fascicular block, which may be followed years later by dilated cardiomyopathy. Later, cardiac disease is sometimes accompanied by apical aneurysm and thrombus formation, and patients may be at an increased risk for strokes. Even in people with asymptomatic disease, a clinical evaluation is necessary. In patients who become immunocompromised, Chagas disease can reactivate as a febrile syndrome that may be accompanied by skin lesions, myocarditis, or meningoencephalitis. 2 drugs, nifurtimox and benznidazole, are the worldwide standards for antiparasitic treatment. These drugs are not approved in the U.S., but are available from CDC for use under investigational protocols for compassionate treatment. A detailed patient history, including the level of patient familiarity with the insect and living conditions in his or her country of origin, as well as blood transfusion and organ transplant history, will help in determining persons who may possibly be infected.